Hello and welcome to the Infuse You podcast. My name is Teresa and I am your host. The goal of this podcast is to help women and young girls fill up their cup. Oftentimes, we are so focused on helping and supporting others that we forget to take care of ourselves too. Today is National Pharmacist Day, and I am joined by a very special guest, Dr. Jericca Dodd. I had the pleasure of meeting her last year. She came to a Honeywell event, and I was very intrigued by the information that she shared with our group. So she is going to talk to us today, but I'm going to share just a little bit about her before I turn it over to her. So she is a pharmacist, as I said. She is an entrepreneur, a coach, and a leader. She has been a pharmacist for 27 years, and she is the founder and CEO of Your Pharmacy Advocate LLC. The mission of Your Pharmacy Advocate LLC is to provide pharmacists advocate care for patients seeking better health results. Dr. Dodd has spoken on many stages across the country. She coaches women in pharmacy to build their brand and business, and she is also the proud chief executive editor of Pharmacist magazine, and that is PHARMASIS, in case you want to look that up. She likes to celebrate women in pharmacy. She gets joy from traveling the world, reading, cooking, and attending cultural events. Dr. Dodd loves to encourage others to be their best selves at every opportunity we get in life, which is why I invited her to be on the podcast, because that's what I want to do. Her favorite scripture is Luke chapter 12, verse 48, to whom much is given, much is required. Dr. Dodd endeavors to live life giving back from the abundant ways in which God has blessed her. Again, Dr. Dodd, welcome and thank you so much for joining us and celebrating National Pharmacist Day. Before we dive into the questions that we have for you today, if there is anyone listening to today's episode who is an aspiring pharmacist or has someone in their family who is looking into becoming a pharmacist, what is one bit of information or one tip that you would share with that individual?
Okay, so first let me say thank you, Teresa, for having me on your platform. And the one bit of advice that I would share with someone who is an aspiring pharmacist is know that healthcare is constantly changing. Healthcare is constantly evolving, but as a pharmacist, you have the capability to impact healthcare in so many ways. So my tip would be to be open to the many different ways that pharmacists can contribute to the world of healthcare, because it's not only the typical ways that we think of when we think of a pharmacist.
Awesome. Thank you. And with that, we're going to kick off the interview asking you what motivated you or led you to pursue a career in pharmacy.
So this may not be this is not necessarily the story that would win the blue ribbon. However, I actually wanted to be a high school English teacher, and at 18, when I was headed off to college, I decided I had a conversation with myself, if you will, and I said, I don't know if teachers make enough money. I think I need to pick something else. I need to pick something in the healthcare field. I had been awarded a full scholarship to go to Florida A&M University, and I was like, I should pick something else. So at that time, courses were in a catalog, as I'm sure all of that is all online now. They were in a catalog. So I literally flipped through the catalog. I looked at nursing and I said, I don't think I would make a good nurse because of the amount of physical patient contact that they have. I looked at physical therapy, and I don't know how I knew this, but I said, I think they dissect cats. Don't want to do that. And I flipped a couple more pages and said, oh, pharmacy. Yeah, I can do that. And I closed the book. I never read the curriculum. So if you can imagine the boomerang that my neck did every semester when this wannabe high school English teacher had a new chemistry class. However, went through pharmacy school and finished, and I would not do it any differently. It's been a very rewarding profession, and I'm grateful that I did make the choice to choose pharmacy.
Awesome. I'm going to add an extra question now that you shared that you wanted to be a high school English teacher. Was English your favorite subject in school, and that's why you thought you wanted to be an English teacher?
Yes, English and history were my favorite subjects. I obviously had to have math and science as well, and I did well in those courses, but English and history were my favorites. And so that's why I wanted to be an English teacher. However, if you can imagine, pharmacy school did not have much English and history courses. So it was quite a culture shock for me. I don't know what I was thinking when I selected it and just closed the catalog and never even looked at the curriculum. But I have since had an opportunity late in the later years of my career to teach pharmacy related subjects, to teach non-pharmacy related subjects. So I feel like I have, though later had that opportunity, I feel that I still got my wish, which is to teach.
Awesome. So can you share with us what led you to start your own business as a pharmacy advocate?
So back in 2015, I had no idea why things in life had happened the way that they were happening. I was working in the pharmaceutical industry, and earlier in the year, received notice that I was being laid off from my job because another company had acquired the company that I was working for. And I took that opportunity to, one, do some things that I thought would be really interesting because didn't really have the time to do them prior to being laid off. So I became a Zumba instructor and was dancing my way through 2015 when my father was diagnosed with stage 4 lymphoma. And I remember going to his appointments and just being a daughter, but also a pharmacist, and being with him, seeing his journey through that health situation, and assisting when I could. But little did I know that in 5 months from my father being diagnosed and with cancer and going through chemo and radiation, that my sister would call me and say that my mother was on the way to the hospital with chest pain. And that chest pain ended up in a triple bypass heart surgery at the third hospital from the one where she started with the complaint of chest pain. And after that surgery, I just remember thinking, if only that anesthesia would just wear off. And what happened was the anesthesia did wear off, but my mother suffered a dementia as a result of that surgical procedure. So not only was she having to contend with dementia, but she was also recovering and going through rehab for having, triple bypass heart surgery. And so I found myself having to be an advocate for her because she really could not advocate for herself. And so I was going to psychiatrist appointments. I was communicating with, nursing home. I found myself in the middle almost of this experience that I could have never planned for, never mind that I was a healthcare professional. And shortly, another 5 months later, little did I know that I myself would be having brain surgery. And so from June of 2015 to October, November 2015, with my mom having her surgery, to April of 2016 having my own surgery and it being brain surgery at that, I really began to see the experiences that my parents had, the experiences that I was having, and realizing that if I didn't advocate for them and myself, that our health could have looked totally different today. And it was never anything that I signed up for or said, this is what I'm going to do. You just find yourself in the throes of what's happening. And because they're your parents and you love them, you would do anything to support their health journey. I realized that if I didn't, I don't know, I'm not going to say that they would have not been here, or that if I had not even been my own advocate, that I wouldn't be here. I just think that we might not have fared as well as we did.
And it's crazy that you share that story about you becoming an instructor after you were laid off, because that's how I got started. I was laid off from my job and I found time to do things that I wasn't normally doing. And one of them was working out and moving my body. And
Yes.
I met some amazing women and I became an instructor. So didn't know that we had that in common.
Yes, we do. So that
Now,
experience is what led
go ahead.
me to say, if I can do this for my parents, if I had up doing that for myself, it led me to say, I want to support other people, because if my parents, like I said, had not had a pharmacist daughter, I don't know that they would have known what questions to ask. I don't know that they would have known the procedures to ask for in their health journey. I think that they would have just fallen victim to whatever was told them to do.
Exactly. Now we hear that term advocate a lot, and I know people that are going to be listening to this episode, they're probably saying, what does she mean by a pharmacy advocate? We have like a healthcare advocate, we have a caregiver advocate. So can you explain to the listeners what you do as someone's pharmacy advocate? What
So
service that you provide for them?
as a pharmacy advocate, and I don't know that that's a term that you could like look up in the dictionary necessarily, but I coined that phrase, if you would, to describe the background that I come from. I'm a pharmacist. I have a pharmacy background, and so obviously, when I look at a person's health, I'm definitely interested in what medications, what supplements that they may, or over the counter agents that they may or may not be taking. But for me, it goes beyond that. It goes to how are they sleeping? What are they eating? How are they moving their body? Because I think health is a multifactorial entity, and it's not just one little piece and part. So definitely when I've worked with patients who have thought, oh, we're just going to talk about my medicines, we talk about so much more, because it's not, my hope is that people will be able, or patients will be able to use as few medications as possible, because generally chronic medications for chronic illness oftentimes will cover up or make the symptoms less. However, it doesn't necessarily fix the problem. It doesn't get to the root of the problem. And it ends up being a more of a band-aid, if you will. And granted, that's a very blanket statement, and everyone's health is individual. But I think that being able to look at an individual and their health and their lifestyle and what will work for them is an additional piece to being an advocate that has a pharmacy background.
Well, that's awesome. I'm sure that a lot of people across the world can benefit from the services that you provide. Being a caregiver advocate for my daughter who's special needs, people don't understand what that means, but just as you said, you want people to be on as less medication as possible. We want her to get as many services available to her as possible to help her live as long as she can. Appreciate you sharing that with us.
Yeah.
So as a patient or a consumer, how would you say would be the best way for me, like, for example, to work with my pharmacist as a patient or consumer
One,
of pharmaceuticals?
I would say tell them everything. Like really be invested in having conversations about your health. At one point in time, there was a major pharmacy chain that's had a tagline in their marketing that says the Pharmacy America Trust. And I would go beyond that and say pharmacists are some of the most trusted healthcare professionals, because maybe you yourself or someone you've heard them say, oh, I went to the doctor, but I didn't tell them this, this, and this. And I can say that as a pharmacist, I have had people come up to me who I don't even know, but who find out that I'm a pharmacist, and they just begin to tell me, I call it their health story or their health history. And so I think it's important that you when you begin dealing with any health practitioner, but we're talking about pharmacists in particular, that you share all the things. So if you take a medication at night to help you sleep, maybe it's an over-the-counter medication. I don't want to do an advertisement for any of the brands, but if you take an over-the-counter medication to help you sleep at night, that factors into how you function by day. So make sure to share as much information, even the things that you think may not be important, maybe you only take it once every so often. Be sure to be honest and forthright and forthcoming about your alcohol intake, about things like smoking. Those are all important. And while it may not seem to be related to your medications, they are. And so I would say that when you work with a pharmacist, ask questions, become knowledgeable about the medications that you're taking. If you're taking a medication and I ask you, well, tell me what you're taking, even if you can't say it off the top of your head, do you keep a list of your medications on your phone, in your purse, in your wallet, what have you? Because you need to be able to communicate the medications that you're on and at least have some idea as to why you're taking them. And so that's just the beginning of working with a pharmacist.
And it's important that you say have the list in your phone. I know many people don't, but when I started being my father's caregiver advocate, I had to list all of his diagnoses, all of his medications. Every doctor that we went to asked, what is he taking and how many milligrams and for what? And I'm like, how am I going to remember all of this? But I put it in the notes on my phone. And then I also had an incident at work. I was part of the emergency response team where we had someone who was unconscious and he didn't have any list or anything of his medications. We were able to unlock his phone and he was on heart medication and had we'd not been able to get a hold of his wife to find that out. I mean, things could have turned out differently, but just from that aspect, people say, oh, why you sign up to volunteer to do these things? Well, because you're helping save someone's life. I mean, I'm not a healthcare provider, but I know CPR. And we were able to get a hold of his wife, find out what medications he was on, give that to the ambulance personnel, and then they were able to get him to the hospital to be treated. But had he had that information documented, that would have been the seconds that we didn't have to waste to get the information or call and get it. So very important tip to share. And also the emergency, in case of emergency on your phone. I've actually filled mine out because if your phone's locked, that's the only way they're going to get the information.
Right, right.
So great
And
information.
I think it's so important for patients to have as much knowledge as possible, even if you are working with someone who is some sort of advocate for you and your health. I had a family member recently call me and say, I talked to the doctor and I told the doctor that this, and this was my complaint. And the doctor said that I should get Prilosec. And I said, well, I don't think you should get Prilosec because you are taking the generic of Prilosec already. So, and she said, oh my gosh, I'm so glad I talked to you because I would have gone and bought Prilosec and been taking that and the generic version of it. So she would have been double medicating. And I said, I'm disappointed that your doctor maybe didn't have a chance to look at your medication list that they have on file to see you're already on it. But I think that it is why we have to advocate for ourselves or have someone that we've designated to support us in advocating for us, because little mistakes like that happen and they usually don't hit a radar until they become big deals. And so those are small things that can impact health down the line. And then when it does impact health, everyone's scratching their head like, well, how did that happen? How did she end up taking double the medication? Because she knew it as a generic, the prescriber was telling her to get the brand name, and she didn't know that they were the same. Or the patient, the family member that called me about it, didn't know that they were the same.
Oh my goodness. Well, I'm glad that she had you to reach out to too, because I wouldn't have known that either. But like you said, had the healthcare provider checked or asked what medication she was on, if it wasn't in her chart, they could have prevented that from happening.
Well, and I think that therein lies the importance of our health is our responsibility. It's not the responsibility of our spouse, not the responsibility of our adult children, not the responsibility of the doctor fully, if you will. Our health, if we have the mental capacity, our health is our responsibility. And so I am so much in favor of knowing what you're putting into your body, knowing what your diagnoses are, knowing what's the plan. Oftentimes people go to the doctor and they're given prescriptions and there's no plan. What's the exit strategy? Am I to be on this for the rest of my life, or is this just a 90-day? But what's the plan around this? And oftentimes the plan is not discussed as to it's just take this and I'll see you in a couple weeks and we'll talk about it more.
Yeah, I've had doctors do that to me. Thankfully, we have a great primary care doctor, and he always talks about the plan. He doesn't like to put you on medications unless absolutely necessary. And unfortunately, there's not a lot of providers that do that or take the time to understand what you're going through and why your blood pressure may be high or why they just write a script and tell you keep it moving.
Yeah.
So,
Yeah.
so my next question is, how do you collaborate with other healthcare providers to optimize medication management?
So, as a pharmacist, whether I am checking prescriptions, filling prescriptions, or whether I'm working specifically with a patient, I think probably one of the more hallmark things that we do is communicate with healthcare providers. Oftentimes, I have had to get on the phone with my parents and say, all right, get a sheet of paper. Here are the questions that I suggest that you ask in your appointment. So in that way, though I can't necessarily be on the phone directly with the provider, I can prepare the patient that I'm working with to know what questions to ask. And when I did that recently and within the last month, and when the patient came back and I said, "How did your healthcare provider respond?" And she said she smiled. And because it really showed that some homework was done, and this was not just this was a guided appointment versus I call it just hopping up on the table on that crinkly paper and waiting to see what someone says to you. This was a guided appointment where the patient went in with probably about 6 or 7 different questions or points that needed to be discussed. So when that happens, it turns into a business meeting. So whether I am communicating with a provider through the patient or whether I'm communicating with a provider directly, either by phone or written means, to say, please consider this, please consider that. My suggestion is this, my suggestion is that. Those are ways that I think pharmacists are very, very much able to have an impact in that, as I said, this sent the patient into the appointment with an agenda of these are some things, because how many patients come out of the doctor's office and go, well, that went fast. I didn't get to ask all my questions. I didn't know what to ask. But what if we actually prepared in advance and you had someone to help prepare you to know what questions to ask, to, communicate on your behalf if that's not possible for the patient to communicate it? Those are the ways that I enjoy most interacting with other healthcare professionals, to make sure that it's a team approach. It's not, my patient versus your patient. It's, hey, we want what's the best outcome for this patient of ours.
So would you suggest if people don't have someone like you to help advocate on their behalf or give them questions that they should ask, would you still recommend that they go prepared with an agenda of some sort and write down whatever questions come to mind, that they don't understand the medication they're on, or what does this mean? Like just some generic questions that they can start the conversation with their healthcare provider?
Yes, I think that you have a different appointment and you have generally a healthcare provider that's going to respond differently and really say, okay, this person is serious. And they may even make comments and go, wow, I really enjoy this appointment, or I enjoy seeing you as a patient because you're invested in your health. I think it also serves to help the patient give the signal, hey, I'm interested, I'm invested, I want a good outcome. I think it's even very, very healthy to talk with the healthcare practitioner about what your goals are. Oftentimes in a healthcare exchange or interaction, the patient's goals are not necessarily discussed, or even, obviously if you go to the doctor and you're in pain, then we can infer that one of your goals is not to be in pain. But let's say that this is a chronic illness. What are your goals? Are your goals to reverse the illness? Are your goals to just quiet the symptoms? What are the patient's goals? I think that is a wonderful place to start a conversation with a healthcare practitioner to say, hey, this is what I want. This is what I'm looking forward to doing about my health, because these are the outcomes or the goals that I want to reach.
Awesome. Now, I know that people have many misconceptions when it comes to pharmacy or a pharmacist. So, what would you say is one of the biggest misconceptions about pharmacists
I
that you
think
want to clarify today?
I'm sorry. I think one of the biggest misconceptions is that we just count pills.
I
I
could see
think
that.
I think that people just assume, oh, you're just the person that counts and passes out pills. And people have no idea how much of a cognitive function is going on while those pills are being dispensed. And most times in an average day, I don't even count pills. I don't see pills, not like you would think. And so I think that's the biggest misconception, is that the pharmacist just counts pills. And I use that word just because we do so much more. We do so much more, and are, I think, one of the healthcare practitioners that would be very valuable to be on anyone's team.
Awesome. Now, on this podcast, I talk about filling up your cup, doing stuff for yourself, keeping yourself motivated. Can you share with the listeners what are some things that you do to fill up your cup or to motivate yourself?
I have definitely learned that I have to fill up my cup because I've had too many instances in my past where my cup was dry and it was just, you look at the bottom of the cup and it was just empty. And yet you still try to pour more out of that cup that logically has nothing else in it. And so the ways that I fill up my cup now are I am getting more active in sports. I have never considered myself a natural athlete whatsoever, but I've gotten to the point where I'm enjoying sports more, whether it be um, bowling or golf or just walking, being out in nature and walking. I was not that child. I used to want to stay in the house and read books all the time. And so definitely that is one of the ways I fill my cup, being out in the sun and getting movement in, which as we get older, it seems to become more and more important so that we don't get stiff. We have to keep moving. I love filling my cup with outings, I say, with friends, to just, whether it's good food, good fellowship, both. I love to take moments to do that. And that is one thing that also not only fills my cup, but fills your soul, to go to say, hey, let's go for a walk. And we're walking and talking. Or, hey, let's try this new restaurant. And we're trying new food, fabulous food, and also talking. And so those are things that are very important to me that I probably took more for granted in the past, but now I savor those moments to be active as well as to socialize.
Awesome. Well, you filled up my cup today with all of this knowledge that you've shared with us about our pharmacists and how to advocate for ourselves. And I hope that everyone listening felt the same way. So, is there anything else that you want to share to anyone listening about being an advocate for themselves, or anything life in general that you want to leave the listeners with today?
So I would underscore and reiterate, Teresa, that it is so important to be in charge of your health. If you have the mental capacity to do it, it is so important to be in charge of your health. And think of your health as you being the CEO of a business, or even having a board of directors. And the board of directors are the healthcare practitioners that you've sought out for their expertise. And you talk to them about your concerns, they give you their expertise, and ultimately, hopefully, you are able to, with them or weighing the information, make decisions for your health that, because I will say that only you knows what it's like to live in your body. And so it's really, really important to take a proactive approach to managing your health, and not just going to sit on the crinkly paper to see what they have to say today, but literally being your own advocate. And if you don't feel that you have the resources or the patience to do that for yourself, then finding who can support you with that. Finding healthcare practitioners that I had someone that I spoke to not too long ago who said they went to a healthcare practitioner and they felt the appointment was rushed, and that they've seen this practitioner a couple of times and they were like, I just feel rushed. And I said, well, it may be time to get another opinion and seek another provider, because you don't want to feel rushed. This is your health. So there shouldn't be a rush, if you will, to take care of you. So I would want people to understand, number one, be an advocate for yourself and find someone to support you in that effort if you need that. And then two, definitely make sure to understand that you are the consumer and you can make choices about the people that you want on your healthcare team.
Awesome. Well, thank you so much, Dr. Dodd. We appreciate you joining us today on the Infuse You podcast. Thank you for all of the great information that you shared. If you would like to follow Dr. Dodd, you can find her on Instagram. Her Instagram is Dr. spelled out DOCTORJ Dodd DODD. She is also on LinkedIn as Dr. Jericca Dodd. So next week on the Infuse You podcast, we will talk about celebrating life. It is easy to forget sometimes, but we are all fortunate to be here. You have been listening to the Infuse You podcast. I hope something was said today that will help you along your life journey. Until next time, continue to do you, be you, infuse you, and be blessed.